Hello, this is Dr. Wanda Cooper. I'm here at the beautiful G.R. Little Library at Elizabeth City State University. Thank you for joining me. This is the first of a monthly series to Save a Life, where we'll talk about issues relating to the pandemic, the vaccines, the facts, your fears, anything that you are thinking about isolation or your mental or your physical health as we deal with this pandemic. Join me monthly as we talk about it. We talk to the subject matter experts and we get tips on how you can protect yourself and your family.
We really are worried that this Delta variant is going to find everyone who's not protected.
The fact that this is more infectious, causing worse outcomes, and spreading like wildfire in the United States, I don't believe this is a wait and see period. It's a time to really roll those sleeves up and get those shots.
There are more people dying this week than there was last week. Our rates of hospitalizations are going up. The people that are losing their lives are the people that are unvaccinated.
And the good news we know is that the vaccines we have effective against this variant and against preventing serious infections in those who do get the Delta variant.
These vaccines are safe, they are effective, and they're necessary for us to try to get back to normal.
Look, you're rolling the dice, you're playing roulette with this, and the longer and longer you wait, the more and more likely that you are to get this and can suffer really severe consequences from it.
Everyone from teens to seniors can get a COVID-19 vaccine. Visit myspot.nc.gov.
Hello, and thank you for joining us for the Save a Life series. I am here with my special guest, Amy Underhill. She's the Health Education Director and Public Information Officer for Albemarle Regional Health Services, where they serve 8 county districts. She's been with the agency for 21 years. Amy received her undergraduate degree in 1999 from East Carolina University. She returned to her alma mater in 2005, where she received her master's degree in health education and health promotion. She enjoys developing programs and materials that promote wellness. She likes to encourage children and adults to make healthy lifestyle changes. She especially enjoys teaching classes on nutrition and chronic health disease. In her spare time, which obviously she doesn't have much with all that going on, she enjoys reading, exercising, spending time with her family and friends, and watching her daughter play volleyball. Amy, thank you so much for your time and all that you do to keep us safe and educate us.
Thank you for having me on this morning, and I look forward to sharing some information with everyone that's watching.
We appreciate that. So tell us what we need to know to properly educate us on how do we sanitize, how do we stay healthy, how do we promote awareness on the COVID and the pandemic, and what do we need to know?
Yep, that's a great question. We have certainly experienced in the last 18 months something we probably never thought that we would by dealing with a pandemic. Although in the public health world, we've actually been preparing for this for many, many, many years with our partner agencies and organizations, with strategic planning and our preparedness plans that we have through ARHS. So, we have been planning, but we certainly have learned a lot along the way, and we continue to work really hard in educating our community about ways that they can stay safe and healthy, throughout this pandemic. One of the things that, we want people to know, certainly that COVID is a disease caused by the virus called SARS-CoV-2. And it's often spread when infected people breathe out droplets, very small particles of the virus, and it does that in 3 main ways. Typically breathing in air when you're close to an infected person who is exhaling small droplets of the virus, having those small droplets or particulates that contain the virus land in your eyes, nose, or mouth, or especially through splashes and sprays like a cough or a sneeze. And then individuals touching their eyes, nose, and mouth with their hands that may have the virus on them. So that's why we have put into place and continue to educate the community about a layered approach to preventing exposure to the virus. So those layers can include wearing a mask. We have gone back and forth about mask wearing, and we know now there is a lot of scientific research that does show that wearing a mask can prevent the spread of the COVID virus and can keep individuals from inhaling those droplets as well. We want to maintain distance from others. We want to keep that 6 foot of distance from individuals. We know that when someone expels some of these small droplets, those particulates in the small droplets can stay in the air. And when you are putting some space between yourself and another person, those particulates do not have the space, if you're really close together, to actually infect other people. So that's really important to keep, that space between others. And washing our hands is also so important. I mean, that's like one of the cardinal infectious disease control rules, that we have, and we've been learning how to wash our hands since we were in preschool. We learned to sing in the ABCs or twinkle twinkle star, to make sure that we're spending at least 20 to 30 seconds, sanitizing our hands properly with warm water and soap. And so really that's, a really, really easy and common thing that we can do to prevent our infection rates of COVID. But we also want to think about colds, and we're entering into flu season now. Right. And so, by practicing good hand hygiene, we're also preventing the exposure to those other viruses that are present in our community as well.
Maybe can I ask you a question? One of the really great points that you made was that you've been preparing for this for a long time. The common misnomer that people have about the vaccine is that it was developed too quickly, or it can't be effective because it was thrown together. And what you said is very apropos, that this is not something you were not preparing for. In fact, the health department, the health agencies have been preparing for pandemics and preparing medicine for quite a while. So can you share a little bit more on that?
Yes. So one of the things that we've been doing to, again, prepare for an emergency, so whether that is a pandemic or it could be, a hurricane, we live here on the coast. And so we have, strong partnerships with all of our emergency management services. In each of the 8 counties that we serve. We work really closely with our hospital systems as well. We've done training exercises over the last several years with our staff and our partners to help in these situations. We have done a mass medication dispensing exercise back in 2000 and I believe it was 15, where we staged at one of our local schools, a medication dispensing exercise. And so that was really helpful in looking and planning for the vaccine campaign that we rolled out in January. So, we have these plans in place, and, we work really hard to make sure that we have the needed partners able when it comes time for some of this. And when you look at preparedness in general, not just here, in our local health department, but the state Department of Health and Human Services, again, has, planning for these things. And on a national, federal level, these plans have been in place for many years. We knew that at some point in time, a pandemic was always possible. We had a small taste of that several years ago in 2009 and 10 with the H1N1 flu epidemic that we had. It was another way for us to kind of prepare. Certainly that epidemic was not on the grand scale of what we're seeing now with COVID. But again, it gave us some preparation, and we knew, that these things were in the works. And so vaccines to address this particular virus, and of course other viruses, because we know we get our flu vaccine every year, and that's a virus that we're preventing from vaccinations. They are tested They're effective. There have been millions of people who have safely received their COVID-19 vaccine, actually over 369 million doses of the COVID vaccine in the United States from December 14th through August the 30th of this year. And so we know that that this technology is what is going to help us to continue to fight and hopefully end this pandemic.
That's exactly right. It's the same thing with measles, the same thing with chickenpox, the same thing with tuberculosis. Every disease that we've had, you've been preparing and addressing it and preparing vaccines that are effective and safe for the community. So I really appreciate you stressing that point, that this is not something that was developed yesterday. You always have ongoing training, ongoing preparation to make sure that we stay safe. And let me just ask one more thing. You notice that you see people with a half mask. So they've got the mask on, but it's over their mouth and their nose is out. So I really appreciate the point that you were making about the particulates in the air, that if you don't have your mask on properly, then you're still not effectively protecting yourself. So thank you for mentioning that very valid point about we have to wear the mask correctly in order for it to protect us.
Exactly. That's so important. And I also want to make a comment too, now that you've mentioned that, that you sometimes will often see people not wearing a mask, but just wearing a plastic face shield. That has not been approved as a source of, of infection control, because with that face shield, because there is the underneath side, those particulates can still get underneath that particular shield. So if someone would like to wear a shield and a mask, that's completely fine, because then that's helping to also protect their eyes. But we can't just use a plastic face shield. You really need to be wearing a mask that's covering your nose and your mouth.
And that's a great point, because it is airborne. So even though that mask might help people breathe a little bit easier because their nose and mouth is not covered, but they're not protected. So basically they're going out without any protection using that type of face shield. So that is such a good point. Thank you for sharing that with us.
Yes, thank you.
So is there any other things that we can do as consumers or to help educate the public about, we have to mask, we need to wash our hands, we have to sanitize, we need that 6 foot of difference because it is an airborne disease? Is there anything else that we can do to do a better job of protecting ourselves and our loved ones?
Yes, so we would certainly encourage you, if you have not been vaccinated yet, to seek out a vaccine appointment. There are several places where individuals can get their vaccine. You can call any of our 8 health departments to schedule a vaccine appointment. Some of our local pharmacies also have vaccine readily available. So that's something else. So seek out, that information is available. If you're not sure, call the health department, because we can get you where you need to be for your vaccine. And just, do your research and educate yourself about the vaccine if you're on the fence and you're hesitant. Some of the research that we have found is that those individuals who are a little hesitant about getting the vaccine tend to listen and feel more comfortable about getting education about the vaccine from family and friends. People who already received their vaccine, and talking to educators like myself or someone at the health department, or talking with their physician. So I encourage individuals to seek out those people that they surround themselves with to get the correct information. We have not only been in a pandemic, but we've also been what we call an infodemic, where we are just bombarded with so much information because of social media that sometimes we don't really know, are we getting the most accurate information? So I just encourage individuals to seek out correct and accurate information by talking to your healthcare providers. So that's really, really important. Research and decide which vaccine is going to be best for you. There are 3 options available: the Pfizer, which has 2 doses that are given 3 weeks apart. There's also Moderna, which is a 2-dose vaccine as well, that's giving 1 month apart. And there's also the Johnson & Johnson Janssen, that's a 1-dose vaccine. So, educate yourself about each one of those options and decide which one is best for you and your family. The Pfizer vaccine has only been approved for 12 years of age and older. So that's something that you do have to remember if you have a 12-year-old and older child or grandchild or a loved one in your family, that's the option for them. So that's Pfizer for 12 and up. So do remember that. So please, again, search that information, find out what's right. Wear your mask, wash your hands often, as we've mentioned. And also, right now, while we're really seeing a large spike again in cases due to the Delta variant, we just want to ask people to choose safer activities for you and your family. Really consider more outdoor activities, and we're still in the time frame where we've got really nice weather. So any outdoors where you've got well ventilated areas is so important. Wear your mask if you're going to be indoors at different activities, and try to keep that 6 feet of distance as well. The other part to help keep us safe and healthy is to also just follow the recommendations. If you are sick with COVID or any other illness, please try to stay home unless you're going to seek medical care. That is one of the ways, this virus is spreading, when people are not adhering to our isolation and our quarantine advisories. So if you're sick, stay home. Try to separate yourself from others, monitor your symptoms, cover your cough and sneezes, wash your hands often. If you're, in a household with others and someone is sick, try to avoid touching those high surface areas a lot, or keeping those areas disinfected as well. So if you're sick with COVID, please isolate and follow those recommendations. If you are a close contact to someone who has COVID, we ask that you follow, again, those quarantine recommendations, and quarantine yourself until you can determine that you are not positive for COVID. That's going to be the other part to this, not only our vaccine and our other mitigation strategies, but also making sure we're adhering to those safety protocols for isolation and quarantine. So again, you're not in the community spreading the virus.
Thank you for that, Amy. And to speak to your point about talking to your family members or your doctor about someone you're more comfortable with. I know I come from a large tribe of people. So one of the things that we did as a family, we did the conference call on what vaccine should we take? Why should we do it? And the bottom line is that we want to protect our families. We want to protect ourselves. And we love the people we love enough to do something that we may not be comfortable with, but that's going to protect our lives. I'm the biggest sissy in the world when it comes to taking shots and needles. So, I was probably the biggest one saying, but I actually had my vaccine taken at Elizabeth City State University. I did it here, and they could not have been more gentle or more patient, or they just made it so palatable. And, with the education, the nurses talked to me. They told me about some possible side effects. And the thing that I appreciate is that if I have a fever or my arm is sore, that's a lot better than being on a respirator in the hospital.
Exactly.
So the means justify the ends. So thank you for the information. Thank you for the education. I know that you have a helpline where people can call to get more information, and we'll put that up on the screen. And we also have information about how people can contact you or contact their local health county to get more education, to schedule to take the vaccine. They can go to Walmart, they can go to Walgreens, CVS. There's several pharmacies, as you mentioned, where they can go and get that. So thank you. Thank you for the time and staying on the wall. All health providers to me are heroes. In the middle of a pandemic, you go to work every day, you provide public information, you make sure we get the vaccine. So we cannot thank you enough for all that you do to make sure that we're safe and keeping our families safe.
Thank you so much. And that is what we are called to do. And that's, our passion and our mission. And we just want our community to be healthy and safe. And so again, thank you for letting me have the chance today to share some more information with our community so we can ensure that that's happening.
We appreciate that. And all of you who are watching, please, if you have questions, you have comments, things you want to know, we'll put up on the screen the email address. Send us an email and we'll make sure that gets to Amy so she can help further educate us on washing our hands and properly wearing our mask and not the face shields and to social distance. Keep that 6 feet. Amy and I are on a Zoom, so we've got more than 6 feet, don't we, Amy? So
Yes.
we're being safe. Otherwise, we'd have to have a mask on, right?
Right.
Well,
Yeah.
listen, thank you for your time. Have a great day. Stay safe and healthy.
Thank you.
Want to go out freely and just make sure everybody's safe around you and people that you encounter with are safe as well, go ahead and get vaccinated.
How else are you gonna go back to being normal, or you really want to wear a mask all day?
Think about your relatives, not just about yourself. I would say consider everyone around you.
I was even on the fence of getting my vaccine, but after seeing my mom get her vaccine and my sister get hers and seeing that they're perfectly fine, I had no more worries.
It's just a shot. It can't be worse than a flu shot.
Well, it helps the community out and not spreading the virus as much.
When more people get the shot, everyone's more able to go outside and it makes like a safer environment for everyone.
Just get vaccinated. That's pretty much it.
You have a spot,
take your shot.
You have a spot, take your shot.
Everyone from teens to seniors can get a COVID-19 vaccine. Visit myspot.nc.gov.
Well, thank you for joining us for our second session of Save a Life series. I am pleased to welcome my next guest, Dr. Emekalam from Elizabeth City State University. He has a very prestigious resume, so I'm just going to give you some highlights. So Dr. Anthony Emekalam is a professor of pharmaceutical science and the chairperson of the Department of Health and Human Studies at ECSU. He's a licensed pharmacist by training. He can practice in DC, Maryland, North Carolina, and Virginia, so he is well versed in his craft. His research interests are the areas of health disparities, drug delivery systems, minority health promotion. He has been actively engaged in mitigating the spread of COVID-19 through education, awareness, convenience testing, and vaccination campaigns. Thank you, Dr. E, for joining us. What an impressive resume.
Well, thank you so much. I'm glad to be here.
You're a busy man helping us eradicate this pandemic and manage that. So I want to ask you some questions about the vaccine. You and I both know that there's all kinds of myths about this, including that it's a conspiracy. It was created by the government to control population. You know, is it one of those things like Tuskegee experiment with the syphilis, where they're just trying out these vaccines on minority populations? There's a lot of chatter out there. And as the subject matter expert, what can you tell us to make us feel more comfortable? What's myth and what's real?
Well, thank you so much for that question. Now, the way I approach this whole issue about what is true, what is fact, and what is false is that I tell people it is always okay to have doubts. There's nothing wrong to have doubts. There's nothing wrong to have questions. But where I have problems is when people have doubts and they have questions and they don't do enough to get the right answer. So we live in the age of information. There is social media, and somebody can post something on YouTube or TikTok or anything, and somebody may look at it and begin to think that there is some facts to that. So as a matter of fact, in this present age, it is crucial that you vet anything you hear. It's never been more important for you to go back and check behind yourself when you hear something or when you read something on the internet or through any of the social pages. You need to go and try and be sure that what you're listening to or what you're hearing or the information that you're receiving is accurate. Now, I'm out there in the community and I've heard similar concerns from people. And some of those myths and some of those things that people believe, sometimes it sounds crazy. First off, let me answer you, this is nothing like the Tuskegee syphilis experiment. It's nothing close. Now, I respect the healthy reluctance of people of Black descent from having some doubts as to what is going on in the American healthcare system. I respect that. But I'm also saying that you need to reach out, find somebody that you can trust and ask questions. We had this virus, attack us aggressively, and we needed to do something to stop it. And I usually say that one of the worst things that ever happened was that COVID-19 chose a very wrong time to show up in America. COVID-19 showed up in an election year. Right. So I thought that was part of the problem we had with it, because it showed up at the very wrong time. Being an election year and politicians being who they are, they started spinning the story to kind of help them. And in the middle of all of that, the truth was somehow either diminished or in some cases completely, eliminated. And so people need to reach out and find out, exactly what the truth is. There is no truth about COVID-19 vaccines causing infertility. That's the one that I hear a lot. Because of some kind of false, there is a false story that showed up on social media. And the thing about these false stories is that they present them to be facts. I've listened to some of these things. Seriously, I listened to some of them and I'm like, wow, if you are somebody who doesn't understand science, it is easily to be swayed because their arguments sometimes seem very, very persuasive.
That's true.
So the way the vaccines work, the current vaccines that we have for managing COVID-19, 3 of them, the way they work is that they teach your body to make a spike protein. That's what they do, pretty much. The vaccines teach your body to make a spike protein that helps you to fight the virus. So somebody posted on social media that spike protein that your body makes is similar to another type of spike protein that is called synthesin. Synthesin is a spike protein that helps in the growth and development of a placenta. These are completely 2 different things. Now, if you are somebody that is naive, the way the argument is presented might appear that it has some weight to it, but it's nonsense. There is no evidence scientifically to show.
Well, it's all about fear. It's the fear that gets us, because, when you hear these theories and these myths, you're automatically afraid. And what's the best source to get that fear aligned? Should you go to CDC's website? Should you contact your doctor? Is there a fact sheet with all these myths that we can refer people to? What's the best method of researching the fact from the fiction?
CDC has a very good resource, but I'm saying, how about talking to a healthcare practitioner that you trust? I'm not going to ask people to get vaccines when I have not gotten it. I have a 12-year-old. As soon as it was approved for 12-year-olds, my daughter was among the first people to get it because I believe in it. So if somebody is saying that this has issues, come ask somebody. And then if I have gotten the vaccines and I'm giving it to my family, then there is good reason for you to believe that I believe in it. CDC has very reliable resources that can help people to fight those myths. But I also said, have conversation, one-on-one conversation with somebody that you trust, and have them walk you through whatever questions or issues or concerns that you might have.
That makes sense. Well, let me ask you this, since you opened that door for me. Thank you for the segue. You said your daughter had the shot and she's 12. Which vaccine is approved right now for children? What is the one, or are there several that are now approved for children?
So now 12 and up can get the Pfizer vaccine. You can, the Moderna is currently seeking to have that, also privileged to have their vaccine available to 12 years, and up. Moderna is approved for people 18 years and up. Pfizer is available for children 12 and up. Pfizer has received full FDA approval. Moderna is looking to get their full FDA approval. So the vaccines, all the 3 vaccines that are currently available in the United States, all of them have shown, science have shown, research has shown, evidence have shown that they are effective in preventing serious illness from COVID-19. All 3 of them. Now, and this is against all 4 variants, the Alpha, the Beta, the Gamma, and the Delta. They are all effective against them. So most of the issues that we're having right now, literally amongst people who are unvaccinated, there is serious evidence that the vaccines work. I mean, if people didn't believe in the vaccines previously, how about over 90% of all the people who end up in the hospital from issues of COVID-19 people who are unvaccinated? Doesn't that in of itself say something?
It does, but that's not the statistic you hear all the time. Yeah, we hear the statistic about the few people that are affected, like when the Johnson & Johnson had the issue. We heard about that, but we didn't hear about the myriad of other people that took the Johnson & Johnson and had no problems, no symptoms. So, it seems like society seems to focus on the negative versus the positive. That's the problem.
And as a pharmacist, look, I tell people the truth. There is hardly a medication out there. And these folks who fight these vaccines, they take other medications for other healthcare conditions. Well, newsflash, there is no medication that doesn't have a side effect. None.
That's exactly right.
There is no medication. If you go, just listen to your TV commercials and hear them talk about this drug that can do this and that. And then towards the end of the commercial, they will rattle out all those things that this can do this. There is no drug that doesn't have some kind of side effect. But
that's a great point. That is such a good point.
The benefit against the risk. And then when you look at the percentage of people who experience that unfortunate side effect from the Johnson & Johnson vaccine, compare that to the number of people who have been vaccinated, it's so marginal that it's actually something that you can consider insignificant.
Well, you're right. And then I know that's true. Even within the same family, the side effects are different, because I took the McDermott. And then my question about that is that I've heard that the McDermott is better for minority populations of people. Is that a fact or is that a myth?
That's not a fact. The Moderna and the Pfizer vaccine are essentially the same thing. They are messenger RNA vaccines. The science behind those 2 vaccines are essentially the same. So, the only thing is that, again, it's the same thing as people who come up to me and they say, hey, I don't want to take this particular medication that is manufactured by this drug company because it causes this side effect to me. And I don't question that, because two drugs may be exactly the same thing, but if they're coming from two different manufacturers, there may be slight tweaks that may not go well with your body, but doesn't matter to somebody else, understandably so. But the foundation, the basic way those two vaccines work is essentially the same. Like I said, primarily what they do is to teach your body how to make that spike protein, and then that spike protein is made, your body produces antibodies that gives you the fighting chance to ward off this virus should you, encounter it again. And people come up to me and say, hey, look, you asking me to get vaccinated. Didn't Miss John Doe or Miss Peter or whoever get the vaccine and now did not have COVID? Well, the vaccine is not going to stop you from getting COVID, but the vaccine is going to prevent adverse consequences should you be exposed. There is nothing that said, the vaccine doesn't say, hey, okay, Dr. Emekalam is vaccinated, I'm not going to mess with him. Let me go find somebody. No, I get exposed to the vaccine to the virus every day. But the difference is that if I get infected, I have a fighting chance. I have the antibody in me to fight off this virus, unlike somebody who is unvaccinated. So the outcome,
basically, the best defense is a good offense. Is that what you're saying,
absolutely,
Doctor?
Absolutely. You have a fighting chance. And
so we're going to have to take a booster every year. Do you see this as the flu shot? That's something that we're going to have to take annually, like the flu shot. We're going to have to do the boosters every year. What do you see long term as the effects it's going to have on our health and moving forward?
There is a good reason to believe that that's probably going to be our reality. And the reason why that seems to be where we're heading is because we have done a very, very poor, our response to fighting this virus has been very poor because we have not been able to agree on anything. There are still people who think that wearing a mask is an abomination. There are people who look at you with an evil eye. I've had all kinds of things. I've seen somebody walk up to me and say, hey, this mask you're wearing is more dangerous to you than this and that. I say, hey, how you say so? He said, you are breathing your own carbon dioxide. The carbon dioxide that you're exhaling, you are breathing in that. I said, science doesn't say that. My oxygen saturation rate is still the same with the mask. So we have not been able to agree on one uniform platform, which has made this virus linger longer than it was supposed to have been around. And as the virus continues to hang around, it continues to change its genetic composition, becoming more deadly and making it more challenging for us to put it behind our backs. So because of the messy work we have done in trying to push this virus back, I have a strong feeling that our reality is that we may have to get these vaccines.
So we've created our own problem by not mitigating this properly and staying aggressively trying to fight this virus. So we're to blame.
There is no question about that. There is no question. The problem, we are the architect of our own, our own fortune or our fate right now. Because if we had agreed from the beginning, you remember when they had the lockdown? We had the lockdown. Yes, we had all those things. We all paid, we all sacrificed. And then summer months came, some holidays came. People threw caution to the wind and felt like they've been in prison for too long and needed to go and enjoy the outdoors. And suddenly we started having this right. So we didn't wait to get this completely under control before we started celebrating. And that is why we still have these patches. It goes up today, it comes down, we do something right, we get it under control, and then we get loose again, and the numbers still start rising again. So until we get our acts together and agree on how best to deal with this, we may be dealing with this for a long time. And that is sad.
As a health professional, are you concerned with the holidays coming and that more people are gathering, more people traveling, that we're going to have another variant of this, or we're going to exponentially make our problem worse because of the holiday seasons that are approaching?
Seriously, it does worry me. Not only the holiday season, schools are reopening, and if you're watching the news and see the serious disagreement as to whether kids has to wear, and then the winter months will soon be here, and then the flu season. It's just like, if we don't do something intentionally and decisively to deal with this and put this behind our backs, I'm afraid we may be on this fight for a very, very long time, and things may actually get out of hands, because the virus is always thinking of ways to beat what we have against it. And you don't want to give it that chance to, for lack of a better word, to think through what its next move is going to be, because
That's
it's
right.
constantly changing to adapt, to find a way to evade what you have against it. And if you keep lagging behind, keep wasting time, then they buy that time and they morph into something else that might be a little bit more dangerous. And then we'll be scrambling around looking for ways to deal with that. And I
Go
don't think
around the
that
new. So we need to really focus on getting our vaccines, social distancing, wearing our mask, washing our hands, just following all those safety protocols that you medical professionals have already told us. We just need to get on board and support what we're supposed to be doing so we can eradicate this disease.
Yeah, I can tell you, I don't know how else to say it. The vaccine that we have in the United States is a blessing. It's a rare privilege to be an American and to live in this country. I have sadly been in situations where we have to throw some vaccines away because they expired and nobody wanted them. I have been through that, and it hurts me to know that there are people who live in other parts of the world that are yearning to just, for the opportunity to get a vaccine. And our vaccines are tested. Our vaccines, the FDA does a good, rigorous work in making sure that the medications that go out to the public are validated for safety and efficacy. Another myth that people throw around is that, it was so fast. Okay, just look at the world and see how things are. We are no longer in the primitive. Things ought to be faster now. The messenger RNA technology has been around for ages. And I'm glad that technology was available for us to use to come up with something that can help us to fight this virus. I think it was timely. That technology was timely. I would say that it was actually tailor-made for the problem that we encountered when we had the COVID-19, because that was the fastest and the easiest way to find something. And even though that it came a little fast, well, a whole lot fast compared to the time it takes to bring other drug products into the market, that didn't diminish the rigorous scientific work that is behind it. And again, the question you ask people is, this happens every single day. Emergency authorization use is something that FDA uses every single day to bring life-saving medications out to people, because you don't want to wait for 10 years. Can you imagine how many lives we're going to lose? And there is substantial evidence that shows that the product was safe and effective at the time of development. We had clinical trials. Even the people who complain about pregnancy, the individuals that participated in a Johnson & Johnson trial, 23 of those individuals got pregnant during the trial.
Wow.
And the one individual that had a problem with their pregnancy was the one that received the placebo. All the ones that received the vaccine had a healthy baby delivery. So
that's amazing.
Participated in the clinical trial of the Pfizer vaccine. The Pfizer vaccine trial.
Well, that's awesome. And I think with this program, the Save a Life series, the time that you're taking to dispel the myths, to share some real factual data, I'm going to send this tape to everybody I know so they can listen to what you said. I mean, everything you said has been so helpful. Everyone's life matters, and your time and your dedication and your expertise in administering the vaccine and being a proponent for minority populations and educating us and making us aware is going to save a lot of lives. So Dr. Emekalam, I cannot tell you how much I appreciate your time and your expertise and your commitment to quality healthcare in our country. And we're going to do our part. We're going to send this tape out. We're going to share the word. We're going to encourage people to get vaccinated and to talk to their medical professionals if they have questions, they have concerns, and also to know that there's no difference between the Pfizer and the Moderna for minority populations. So you've set a lot of myths straight. We don't have to worry about not being able to have children after we vaccinated. So you've answered a lot of questions that we have and answered them really well. So I cannot even tell you how much I appreciate your time and your expertise.
The pleasure is all mine.
So thank you, sir. I'm sure we'll be talking to you later on in the series. The next session we have coming up on October the 28th talks about COVID in kids, and you talked about your children being vaccinated. So we'll have to have a chat about that next month and maybe even interview your children to ask them how they felt about having the vaccine and if they experienced any side effects or kind of what was their process and what do they tell their friends. It would be interesting to get their take on the whole thing.
Look forward to that.
Thank you so much, sir. Listen, you have a great day. Stay safe and stay on the wall. We need your help.
Thank you.
Thank you so much for joining us for our first episode of To Save the Life series. Special thanks to my guest, Amy Underhill from Albemarle Regional Health Services and Dr. Anthony Emekalam from Elizabeth City State University. Our next episode will talk about the COVID and your kids. To take the shot, your fears, the facts, get them straight here. Join us as we talk to the subject matter experts. We deal with your facts and the fears as we move forward. Oh, and don't forget to mask.
Next on the Save a Life series. The Save a Life series is brought to you by Thank you for watching.